This is the operating theatre. When the students come, they have to observe. With us, they observe the anesthesia, but with the surgeons, they observe the theatre. With the anesthesia, we will show them how we prepare a patient who is coming. We call it intraoperative. So the patient will be coming intraoperatively, and then we show them how we intubate, how we give our anesthesia, how the patient will be made to sleep pharmacologically, because that is what we do. We give them hypnosis, and then they get sleeping or they get sedated, and then we give them other drugs that will relax them, the muscle relaxants. That is our anesthesia, and we also give them what we call analgesia for pains, so that they don't feel pain. We teach the student all that so that they understand how anesthesia, when they read, and what the practicality thereof. So we mix theory with practicals. Operating, the student can see what is safe. Let's say they are operating on a small part, they can see that it will be magnified on that minute.
The students from the University of Limpopo benefits from variety of modalities that we have in Mankweng Radiology Department, being the CAT scan, CT, computerized axial tomography. That's where we do all the slicing of the different parts of the bodies. We've got conventional X-rays, where we do the normal X-rays, the hands, the chest X-rays, and we have sonar machines, where we use the sound to do different types of examination using the sound technology. And we have mammograph machines, where they'll be benefiting by seeing the examinations being done on breast exams to check the lumps and the cancer, to detect the cancers early. We have theater radiography. We have several machines in the theater where we do the orthopedic works, where the bones are being fixed. We have a Lotox machine. It's in trauma unit. They'll be learning more about the imaging of how patient management of the trauma patients.
ClinPath, basic micro, that will be your TB, AFPs and oromine, and then we'll be doing a bit of virology, which is your hepatitis and HIV viral load and COVID. General chemistry will do all variety of tests. It will be your basic general chemistry, endocrinology, and some of the special chemistry tests that we do on site. It's a pre-analytic system. That's where we load and then it will be kept and channeled through the tunnel into the machine. So people are not directly involved. Really, when it gets in here, the most of the same.
This is our dispensary, where we dispense medication. We dispense for chronic patients, and then also for specialized patients like skin, peds, ARVs. In the morning, we pack our boxes and go to the clinics. We get medication from this dispensary. We have got about 20 clinics that we support as the hospital. The doctors go to the clinics, and we as pharmacists, chronic pharmacists like myself, I work at the clinic. So we support the doctors there at the clinic. They see patients and we dispense.
We provide support to PhD students. The students will be able to access print and online journals. For instance, access to the e-packages, clinical key, the research articles. Access to lab is one of the most important factor in postgraduate research, especially PhD. They must have sufficient time to do research.